Right. As I mentioned already, a critically ill 19-year-old girl and her family are fighting the NHS in court over plans to stop her treatment and proceed with end-of-life care. As anonymised by the court, ST has said, "I want to die trying to live. We have to try everything." So, to discuss this problematic case is the director of the Anscombe Bioethics Centre, Professor David Jones. David, good evening. Why is this case being hidden behind, these restrictions on talking about it?
Well, I'm afraid that's the norm. You will see this in relation to the Charlie Gard case. The Court of Protection routinely prevents parents from speaking about their child, ostensibly for the good of the child, because exposure to publicity can be detrimental. But in fact, I do wonder who the Court of Protection protects, really, because it doesn't protect the rights of parents to allow the public to understand. But this is very, very common. This is very common.
Some people might say that this tragic story of a young woman dying is already concluded in one way, and that they're taxpayers and they would like this money to be invested on someone who has still had a life ahead of them. What would you say to those people?
Well, it's not simply the question of should she get treatment or not, and should she get treatment on the NHS or not. The first question, fundamentally the first question is, can we hear her voice? That's the first question. And is the fact that you disagree with your doctors sufficient to say that you lack mental capacity? Because this is a very worrying case. In this respect, it's a very worrying case. In not reporting it, it's quite common. But in saying, because you disagree with your doctors, therefore you actually don't have capacity even to disagree, that this is something new and something very worrying.
Can you explain why the judge has come to her judgment, do you think?
So the trust think that the young woman in question is wrong, and they've tried to persuade this young woman to think about what would be the options if things didn't work out. And she doesn't want to talk about that. She wants to talk hopefully about things. And so they've been frustrated in this way. She's somebody who's quite determined, and her family are quite determined to do as much as they can to give us the small chance, and I think honestly it is a small chance, but to give that small chance that something might help her. And because they've been so frustrated, they've gone to the court and they've said to the court, we can't talk sense to this girl, and therefore we want you to say that she hasn't got capacity, so we can then bypass her and then make a best interest decision on her behalf. So
I made a point in my monologue about the fact that if you are making a premeditated decision to deny someone the right to life, that is in its own way some form of murder. Would that be too strong for you?
No, I think it would be too strong, because lots of people want things from their doctors in the hope that it might help, and the doctors honestly don't think it will help, and doctors are not obliged to give what they don't think will help. And that might be that's part of the situation here. They honestly don't think it will help. She wants something. The fundamental problem here is it's all, as you say, in secret. It's all hidden. She can't go public about this. She can't decide that she wants to have private. Obviously, this is the great heresy in this country. She can't have private medical treatment if the NHS decides they don't want to fund this. It's the NHS that don't want to fund this. That is a decision that we might want to make.
Well, the NHS have actually, sorry to interrupt you, the NHS Trust have said, because of the balance on, the NHS Trust have said, our focus remains on providing the very best of care and support to the patient, their family and the clinical teams in these very distressing circumstances. Is the very best of care to kill someone?
So sometimes, often, there's little that medicine can do. And sometimes trying to do something when there's not much you can do left will do more harm than good. Doctors sometimes do more harm than good. So I think that doctors sometimes they want to step back and they want to say we think we've done enough here. We can't do anything more. The problem here is honesty and transparency, and the voice of the person who is most affected has actually been taken away in order for the doctors to have more of an easy ride in saying, in order for the doctors
you're
to be able...
You're allowed to offer a view. I can challenge it. You say exactly what you think. If you think she's being denied a voice to protect the doctors, you say what you think, and I'll challenge you.
Well, I think it's easier for a doctor to say, we think it is in your best interest to not have treatment, and you're not competent to say otherwise, than to say, we know you want treatment, but we're not going to give it to you.
Where is the balance? Where is the balance between a taxpayer-funded health service that needs to look after the needs of patients across the community and the rights of someone to extend their life? I mean, is there a debate to be had, or in my view, you have the right to life. It's Article 2, isn't it? So you have the right to life. But I mean, where is the balance?
You have the right to life, but you don't have the right to every most expensive treatment, which probably won't work in your case and might work for somebody else. So there are very difficult decisions to be made about allocation, and people often duck those decisions. But the key thing is transparency and allowing things to happen in public and allowing people to have their voice. And most of all, not saying, because a young woman disagrees with her doctor, we can say she's not competent anymore. I mean, this is the woman in white. This is saying you have got someone who we don't like what you're saying, so we will say we will take away your right to speak, take away your right to be active. That's what I find sinister and all.
Which to me, as much as I'm trying to be balanced, because I've got to be, is possibly the deepest cruelty you could ever commit on another human being.
I think that the fact is she's very, very poorly. She's really, really sick. It's unlikely that she'll get through this. And whatever she does, even if she won her case and the judge had made a different decision, they'd done everything they could. She got onto this Canadian, or a couple in the States, I think, experimental trial. Likelihood is it's not going to work. That's the most likely outcome. But she wants to die trying. That's what she wants.
And that is the fundamental part of the right to life. David, thank you so much.